Good morning, Dr. Fabel.
Good morning.
How are you enjoying the IDS so far?
Well, as every year, it's an amazing opportunity to meet everybody, to see all the news in the dental field, to join friends, to network. So I really like it to be here.
I see. And this time we are, our podcast is called All Pulp No Fiction podcast. And we are happy to be here also, in the booth or near the GC booth. And I've been interviewing many of our guest speakers. I attended your lecture, obviously, and I thought it was very interesting, the approach of one visit dentistry. Could you talk to us a little bit about, when do you use this approach and with what patients? Yes, please.
Well, when it comes to single visit dentistry and when it comes to implement new workflows, there is two possibilities how to shorten the whole procedure. Because usually you have a certain amount of time when you make the preparation of the tooth. Well, then you have a certain amount of time for the production of the crown or inlay or whatsoever. And then you have the delivery time.
Yeah.
So, how much time do I need for the production and the post-processing in order to not make a second injection for my patient? In order to leave him in the treatment room and not take him out, let's say, for a walk. So this is the background why I am looking for workflows either to shorten, let's say, the milling time or to shorten the post-production. That was, let's say, the first approach.
Awesome.
And then the second was, to try to find a material which is suitable, also being polished as well as being glazed. And this is how I came to the Lisi product.
Products, yeah.
And this is how I made my lecture.
I see. And obviously, the evolution, let's say, of digital dentistry makes this a lot more feasible, a
Yeah.
lot more possible.
Yeah.
So, when did you start to utilize these technologies, and how did they help you reach out to this workflow that you introduced in the lecture?
Well, I am at Syracuse a pretty long time already. I started in 2008 doing it, let's say, in a daily basis. And by now, I would say I do at least 60-70% of my treatments in chairside
I see.
treatment. So how did it begin? I think in the first approach, I was just curious about the new technique, curious about not anymore being able to make physical impressions, but digital impressions. So this is what me attracted first, and then I found out it's a real game changer in our practice life because people are so amazed still today when they don't get impressions in a physical way, but in a digital way. So everyone who is joining our practice the first time either is recommended by a patient who tells him or her that we work digitally, or when he finds out he's really happy about it.
I see. And obviously, especially like for one-day visits or like one-day treatments, it's gonna be a lot more difficult to do it with, classical way or like conventional. It is possible, but it's going to be, I don't know, like it's gonna take a little bit more time or maybe more effort. I don't know.
It would take, I would say, even if there would be a lab technician who would start working immediately, it would take half a day.
Yeah, it's gonna take
from morning to evenings.
A lot more time.
Yeah.
And thank you. A little bit earlier, you mentioned Lisi blocks. What properties of the Lisi blocks that attracted you for this kind of treatments?
As I already told you, first I was a bit hesitant. I waited a year or two if results would be really as well as the promised result should be. So when I tried out them, I found out that, I mean, the brilliance after polishing is really, really high. And also the minimal thickness of 1 millimeter is comparably low, because usually when you prepare for a ceramic dental crown, you need at least 1.5 millimeter with the most materials. So 1 millimeter thickness is quite an advantage in our daily work. And the color trueness after polishing is also very, very high. So I don't lose any physical advantages. Also, I do not glaze my crown, but only polish.
And it doesn't need a furnace, right?
No,
So like that's
no
so
glazing, no firing.
yeah, makes it
No glazing, no firing.
makes it a
I
lot
mean, you
more
could.
convenient. Yeah.
You could.
Yeah.
If you want a highly aesthetical results, well then,
But then
go for it.
But then it depends on the dentist, right?
Yeah, I need more time, and maybe it's a different approach.
Yeah.
But for a single visit treatment, let's say for a very large group of our patients, also elderly patients who are not able to stay a very long time in my practice, it's more than convenient when I have a shorter production time.
Right.
So they are really, really grateful and thankful for a shorter process.
So, what's the majority of the patients that you see can benefit from this kind of treatment? You mentioned elder patients. Maybe also patients who are traveling, right? If they need to kind of make sure that they do it in one short
Well,
visit.
time matters for everybody.
Right? Yeah.
Time matters.
Yeah.
So it's, I think it's for every patient, it's a win. It's an absolutely winning situation when he or she can leave the practice after an hour and 10 minutes and check my crown is done. But in the end, you are absolutely right. It's not only the time which counts. The results, the clinical result, the durability, all the physical, properties our crown has to have. They have to be perfect. It's not that we want to just push things forward only to gain, let's say, 5 minutes. This is not our purpose. But it's very, very helpful when you have perfect results and save time in the same way.
Exactly.
So,
Yeah.
win-win.
Yes. So, if you would have one takeaway point that you want to share with our audience, what would that be?
Well, give Lizzie a chance. It's about to be everybody's darling who tried it already. Yeah, I just can tell you that. At least out of my community, I worked with CEREC quite a long time, and I spoke with a lot of my colleagues who really like the material. It's very flexible because you can individualize it if you need, but you can also push things forwards by polishing and save time.
Yeah. And I think during the lecture, I'm sorry, I'm going to go back a little bit to the lecture. When I asked you about how many units would you produce, like you said, maximum two units, something like that.
Yeah.
Yeah.
So this is more or less my usual.
I see. So if you for you out there, for dentists out there who are interested, you can use, if a patient needs 1 or 2 units, please use DC blocks. 1-day treatment, it could be useful for their practice, right?
Yeah.
Okay, so thank you very much, doctor.
You're welcome.
Appreciate you.